Zika virus is a concerning health threat that has garnered significant attention from the global health community. It is spread primarily through the bite of infected Aedes mosquitoes, which are known for their aggressive daytime biting habits. These mosquitoes are most active during daylight hours, particularly in the early morning and late afternoon. Zika can also be transmitted through sexual contact, making it important to practice safe sex, especially if you or your partner have traveled to areas with Zika outbreaks. It can pass from a pregnant woman to her fetus, potentially causing serious birth defects such as microcephaly, where the baby's head is smaller than expected. In rare cases, Zika spreads through blood transfusions, highlighting the need for stringent blood screening processes. Zika virus was first discovered in 1947 in rhesus monkeys in the Zika forest of Uganda. It was named after the Zika forest in Uganda, where it was initially identified. The virus has since spread to various parts of the world, causing outbreaks and health concerns on multiple continents. Outbreaks have occurred in Africa, Asia, the Americas, and the Pacific Islands, affecting millions of people and prompting international health responses. Zika virus is a member of the Flaviviridae family, which includes other significant viruses. This family also includes dengue, yellow fever, and West Nile viruses, all of which are transmitted by mosquitoes and can cause serious health issues. The virus is closely related to the Spondwini virus, another mosquito-borne virus, underscoring the importance of mosquito control in preventing these diseases. Zika virus infection often causes mild symptoms. Many people infected with Zika show no symptoms at all. When symptoms do appear, they typically last for a few days to a week. The most common symptom of Zika is fever. Other symptoms include rash, joint pain, and conjunctivitis, also known as red eyes. Muscle pain and headache are also possible. Because Zika symptoms are often mild, many people don't realize they have the virus. This can contribute to its spread, as infected individuals may unknowingly transmit the virus to others through mosquito bites. Zika virus poses a serious risk during pregnancy. It can cause a birth defect called congenital Zika syndrome. This syndrome can lead to severe health problems for babies. Congenital Zika syndrome can cause microcephaly. This is a condition where a baby's head is smaller than expected. Babies with microcephaly may experience developmental delays. Other birth defects associated with congenital Zika syndrome include eye problems, hearing loss, and impaired growth. The virus can also lead to miscarriage, stillbirth, or death shortly after birth. In rare cases, Zika virus infection can lead to Guillain-Barré syndrome, or GBS. GBS is a serious autoimmune disorder. It affects the nervous system and can cause muscle weakness and paralysis. GBS occurs when the body's immune system attacks the peripheral nerves. These nerves connect the brain and spinal cord to the rest of the body. The exact cause of GBS is unknown, but it is often triggered by an infection. Symptoms of GBS typically begin with weakness and tingling in the extremities. This weakness can spread rapidly, eventually affecting the muscles that control breathing and other vital functions. In severe cases, GBS can be life-threatening. Section 5. Protecting yourself and your family. There is no vaccine to prevent Zika virus infection. The best way to protect yourself is to avoid mosquito bites. This is especially important for pregnant women and those who live in or travel to areas where Zika is present. Use insect repellent containing DEET, picaridin, or IR3535. Wear long-sleeved shirts and pants when outdoors, especially during daylight hours when Aedes mosquitoes are most active. Eliminate standing water around your home. Mosquitoes breed in standing water, so removing these breeding sites can help reduce the mosquito population. Use mosquito nets over beds, especially in areas without air conditioning or screens. Section 6. Managing Zika symptoms. There is no specific treatment for Zika virus infection. Treatment focuses on relieving symptoms and supporting the body's natural healing process. Rest is important to allow the body to fight off the virus. Drink plenty of fluids to stay hydrated. This is especially important if you have a fever. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help reduce fever and relieve pain. If you suspect you may have Zika virus infection, it is important to see a healthcare provider for diagnosis and care. Early diagnosis can help prevent complications, especially in pregnant women. Section 7. Diagnosis and testing. This section delves into the crucial steps and methods used to identify the presence of the Zika virus in patients. Diagnosing Zika virus infection can be challenging because its symptoms often mimic those of other mosquito-borne illnesses, such as dengue and chikungunya. These illnesses share common symptoms like fever, rash, joint pain, and red eyes, making it difficult to distinguish between them without specific tests. Healthcare providers rely on a combination of factors to make a diagnosis. They consider the patient's symptoms, medical history, and potential exposure to mosquitoes in areas where Zika is prevalent. A thorough medical history and physical exam are essential. The doctor will carefully examine the patient, looking for signs that are characteristic of Zika virus infection. The doctor will ask about recent travel history, possible mosquito exposure, and symptoms. This information helps narrow down the likelihood of Zika virus infection, especially if the patient has traveled to areas with known outbreaks. Blood tests are the primary method for confirming Zika virus infection. These tests are crucial because they provide concrete evidence of the virus's presence in the body. These tests detect the presence of Zika virus antibodies in the blood. Antibodies are specific proteins that the immune system produces in response to the infection. Antibodies are proteins produced by the immune system in response to infection. Their presence in the blood indicates that the body has been exposed to the virus and is fighting it off. Molecular tests, such as polymerase chain reaction or PCR, can also be used to detect the virus's genetic material. PCR tests are highly sensitive and can identify the virus even in the early stages of infection, providing a definitive diagnosis. Section 8. The global fight against Zika. The emergence of Zika virus has prompted a global response to control its spread and mitigate its impact. Public health organizations, governments, and research institutions worldwide are working together to combat the virus. The World Health Organization, or WHO, has played a leading role in coordinating international efforts. This includes providing guidance to affected countries, supporting surveillance and outbreak response, and promoting research and development. Efforts to control mosquito populations are crucial for preventing Zika transmission. This includes insecticide spraying, larvicide application to breeding sites, and community-based mosquito control programs. Section 9. Ongoing research and advancements. Scientists are diligently working to develop a vaccine for Zika virus. Several vaccine candidates are in various stages of development in clinical trials. These vaccines aim to stimulate the immune system to produce antibodies that protect against Zika infection. Researchers are also exploring new methods for controlling mosquito populations. This includes genetic modification techniques to reduce mosquito lifespan or make them resistant to the Zika virus. Furthermore, scientists are investigating the long-term effects of Zika virus infection, particularly on children born with congenital Zika syndrome. Understanding the virus's long-term impact is crucial for developing effective treatments and support systems for affected individuals. Section 10. Staying informed and seeking guidance. In today's interconnected world, staying informed and seeking guidance is more important than ever. Staying informed about Zika virus is crucial for protecting yourself and your family. This means regularly checking updates from trusted sources and understanding the latest recommendations. Reliable sources of information include the Centers for Disease Control and Prevention, the WHO, and local health authorities. These organizations provide up-to-date information on the spread of the virus, preventive measures, and travel advisories. If you are pregnant or planning to become pregnant and live in or are traveling to an area with risk of Zika, it is especially important to stay informed. The virus can have serious implications for pregnancy, so knowing the risks and how to mitigate them is essential. Consult with your healthcare provider. They can offer personalized advice based on your individual circumstances, such as your health history and travel plans. Healthcare providers are equipped with the latest information and can guide you on the best practices to protect yourself and your unborn child. They can also help you understand the symptoms to watch for and the steps to take if you suspect an infection. Remember that knowledge is power when it comes to infectious diseases like Zika. Educating yourself and your family about the virus can help you make informed decisions and take appropriate actions. By staying informed, taking preventive measures, and seeking prompt medical attention when necessary, you can significantly reduce the risk of infection. Simple actions like using mosquito repellent, wearing protective clothing, and avoiding areas with high mosquito activity can make a big difference. We can collectively combat this global health threat by working together, sharing information, and supporting community efforts to control mosquito populations. Together, we can make a difference in the fight against Zika and protect our loved ones.